Good afternoon. My name is Nicholas Maynard. I'm a patient navigator. My job as a navigator is to help people through their journey with this healthcare system. I do this by helping basically get them whatever they need, whether that be doctor's appointments, nutrition plans, or even transportation to and from these doctor's appointments. Now, I believe strongly that a problem that needs to be solved is stress. In essence, stress is the body's basic response to any kind of stimulus. Most people experience stress at many points throughout their life, no matter what the age is. It mostly occurs at points of major life changes, though, whether this be going to a new school or getting a new job. But it also happens on a day to day basis, whether someone has like a test or maybe a big presentation. There is no specific frequency for stress because it's almost entirely dependent on the person experiencing it. Some people can experience it every single day, other people never feel stress for their entire life. The intensity of stress is dependent on how well this individual person can handle it. Some people who are good at handling stress can brush it off like it's nothing. Other people experience severe panic attacks. The duration is also dependent on the person experiencing it. Usually it lasts as long for a certain stressor will persist. Say you have a test in a few days, usually you're going to feel stress until after the test is done. The onset of stress, most people will start to feel their heart rate speed up, they'll take faster and shallower breaths, and their muscles will tense up while the mind races. There has been studies that prove that stress does not only have a direct impact on their mental health, but on people's physical health as well. It's even said by many healthcare professionals that it's hard to find a disease where stress hasn't played a physical role. One example of this is heart disease. Patients who experience a myocardial infarction, which is another name for a heart attack, generally report having much higher prevalence of stress within the last year of having this heart attack. There are also case studies that show people who experience cardiac arrest or a sudden heart related death do so in moments of great fear, grief, or anger. In other words, when they feel high stress situations. Anger is in particular one of the worst stress responses that your body could have. People who frequently respond to situations with intense anger have a 3 times greater risk of a heart related incident. I think a practical solution to address this problem of stress is having my individual patients do daily breathing and meditation routines. These would cost them almost no time and virtually no money. There should be no excuse as to why this person who wants to relieve their stress couldn't find 15 minutes in a day to just stop, breathe, and collect their thoughts so they can clear their mind out. Now, I know this is a very simplistic solution that I'm almost simplifying this problem of stress, but I think that it would really, really make a difference in a lot of people's lives. Yes, I believe I represented myself professionally by wearing a shirt and tie, speaking clearly, concisely. I think I talked at a good pace. Also explaining my role as a patient navigator and how I help people. I did make the case that change is both needed and possible with stress by through like the diligence of myself and as a patient navigator and the patients. I explained the numerous causes of stress. I think I did discuss the FIDO or impact factors adequately, considering some answers regards to stress aren't very definitive. It's more so dependent on the different patients. I do think I had a practical solution, but I also don't know if this would be adapted by this healthcare provider, mostly because there maybe isn't so much definitive evidence on if that type of treatment would work for different people. Again, because stress is such a very personal thing, it varies from patient to patient. I think that what I did best was tried to speak clear and concise. I tried to look in the camera most of the time, or at least look very close to the camera to do better. Maybe I could have In terms of what I could do better, honestly, probably picked a better topic for this thing because stress is almost, I would say, a problem that it can almost never be really solved just due to the fact that it's, again, such a personal thing and it varies on how everybody handles it, how people experience it differently than others.